Hello everybody. Now I'm going to show you some important veins of your body in this model. It's difficult to show all the veins in a model like this. However, this is a good arterial system and venous system model, circulatory system model. So let's see which veins we can see in this model. So first, let's start from the heart again. Remember one thing, in case of arteries take blood away from the heart. That means the large arteries give blood to the smaller arteries. In case of venous system, veins bring the blood towards the heart this way. Arteries take the blood away from the heart that way, and veins bring the blood towards the heart. So small veins give or drain blood into the larger veins, and then the largest veins bring the blood into the right atrium, into the heart. So this is the right atrium. It receives deoxygenated blood from the body. Who bring the deoxygenated blood from the body into the right atrium? These two large veins. This one brings blood from the upper part of the body. This is the superior vena cava, gives blood to the right atrium, and this one is inferior vena cava, brings blood from the lower part of the body into the right atrium. Okay, so superior vena cava, inferior vena cava. Let's first see the superior vena cava. Superior vena cava divides into two veins. This is the left side, right? So this is left brachiocephalic and this is right brachiocephalic. Right brachiocephalic is short here, only this part here. This one, left brachiocephalic, which is longer, okay? Then brachiocephalic divides into two. One goes towards the head. Also you see here, this is left brachiocephalic, divides into two. This one goes towards the head and this one goes towards the head, and these are the internal jugular veins. Okay, so this is the right brachiocephalic, divides into right internal jugular and subclavian vein, and this is the left brachiocephalic. Same way, it divides into left internal jugular vein and left subclavian vein. Okay, internal jugular veins go to the head part. Okay, and now let's see the internal jugular. What happens? This is the internal jugular. Okay, it gives a big branch here, and this is called the mandibular vein. Okay, because this is the mandible, this is the bone called mandible, so mandibular. And from that mandibular vein you see the facial vein, superficial temporal vein, those veins arise. Okay, and the main internal jugular, internal, remember, goes to the brain and gets deoxygenated blood from the brain. Okay, so that's why internal. Okay, now let's see the subclavian. This is the subclavian. In this side they have dissected it, so you don't see it. In this side you can see this is the subclavian vein. Okay, then subclavian vein is like subclavian artery, goes to the armpit and becomes axillary vein. Makes sense? Axillary vein. And then you see from the axillary vein, this vein arises, and this is a long vein, goes all the way down to the forearm, and this is a superficial vein. This is called the cephalic vein. Cephalic vein. Okay, and also from axillary, this another superficial long vein arises. This one also goes to the forearm, and this is called basic. So from the axillary, this is the axillary, subclavian becomes axillary, and from axillary, two superficial veins arise. This one is the cephalic one, cephalic vein, and this is the basic vein. Okay, and then axillary goes to the arm and becomes the brachial vein. However, you see here, this is the beginning of the brachial vein. They have dissected it here, so you don't see here. So brachial vein goes like this into the arm. However, brachial vein is a deep vein, and cephalic and basic, those are superficial veins. Okay. Now, here you see in front of your elbow, cephalic and basic are connected by this vein. This one is called the median cubital vein. You already know the front of the elbow is the cubital or antecubital area. So this vein is called the median cubital vein. And you have seen that for the blood lab, we collect the blood from this vein, median cubital vein. Okay. It is a superficial vein, easy to get blood from it. Okay. So now let's see, this is the cephalic, okay, and this is the basic, and those are the superficial veins. Okay. And this one here is called median antebrachial vein. Okay, median antebrachial vein. Okay, and now although you don't see here, but that is also a very important vein, as I mentioned, that the axillary vein becomes the brachial vein in the deeper part of the arm, right? And when the brachial vein goes to the forearm, it divides into radial and ulnar. Very similar way the artery works. So you remember, this is the brachial artery, divides into radial and ulnar. Similarly, the brachial vein, it's not shown here, divides into radial and ulnar veins. Those are deep veins, brachial, radial, ulnar, and cephalic, basic, and median antebrachial, those are superficial veins. Okay. Now, let's see the inferior vena cava. This is the inferior vena cava. It runs beside the aorta, abdominal aorta, and inferior vena cava receives blood from a number of branches. This one, you see, from the liver, there are more than one, and this is the hepatic vein. Okay, and here, this is the gastric vein. So hepatic, gastric, and here, this one is superior mesenteric, brings deoxygenated blood from the intestine. Remember the mesenteric for the intestine, okay, and these two are getting blood from the kidneys, deoxygenated blood. So these are the renal veins, right renal vein, left renal vein. Okay, and lower end of inferior vena cava divides into two common iliac veins. So same way as the aorta. You remember the lower end of aorta divides into common iliac arteries. Same way, these are common iliac veins. And common iliac divides into external iliac vein, which goes to the thigh. So this is the big one, and the smaller one is internal iliac vein for the pelvic organs. Okay. Now, let's see the leg. In the thigh, the external iliac becomes femoral like the artery. However, they have dissected it, so you don't see the femoral vein here. It should be, vein, deeper vein in the thigh. And here, this long vein, this is the longest vein of the body, arises from the very upper part of the external iliac, and this is called the great saphenous vein. Great saphenous vein. This is the longest vein because it starts from the very upper part of the thigh and goes all the way to the foot. Okay, so this is the great saphenous vein. And then this one here, you see, this is called the small saphenous vein. Okay, so this is the great saphenous vein, superficial vein. This is the small saphenous vein. This is also superficial vein. However, deep vein is the femoral vein. They have dissected, so you don't see here. Okay, and those are the veins you can see in this model. Okay, so let's quickly go over again. So this is superior vena cava, this is inferior vena cava. Superior vena cava divides into right brachiocephalic and left brachiocephalic. Which one is longer? Left. Okay, and brachiocephalic vein divides into internal jugular and subclavian. Internal jugular, subclavian. Internal jugular enters into the cranial cavity and receives deoxygenated blood mainly from the brain. And this is the mandibular vein, and it gives branches. Those branches supply or receive deoxygenated blood from the outer part of the head. Okay, superficial temporal vein, facial vein. Okay, now subclavian. Subclavian goes to the armpit, becomes axillary, and then goes to the arm, becomes brachial, not shown here. Brachial divides into radial and ulnar, not shown here. Okay, those are the deep veins. And from the axillary, this superficial vein, this is the cephalic vein, and this one, another superficial, that's the basic. And in front of the elbow, they join by this median cubital vein. Okay, and in the forearm, this is called median antebrachial vein. Okay, and now let's see the inferior vena cava. Hepatic vein for the liver, gastric vein for the stomach. This is superior mesenteric vein. Okay, and two renal veins. Lower end of the inferior vena cava divides into right and left common iliac veins. Common iliac divides into external iliac, which is bigger, goes to the lower limb, and internal iliac, this one smaller, for the pelvic organs. Same way this side, the left common iliac divides into left external iliac and internal iliac. Okay, and now let's see in the thigh. They have dissected the femoral vein, which is the deep vein of the thigh. You can see the superficial one. This is the longest vein of the body. This is the great saphenous vein. Okay, and this is the small saphenous vein.